This is Dr. Jan English-Lueck, and today's mini-lecture discusses community-based interventions and organizational capacity building. You are reading two articles based on organizational interventions and capacity building. The first one is by Kenneth McElroy and his colleagues, Community-Based Interventions, and he is at the Center for Community Health and Development in Texas. And the second one you're reading is Strategies for Community-Based Organizational Capacity Building, Planning on a Shoestring Budget by Ruth Wettehall and her colleagues at the University of Kansas in Wichita. McElroy is considering the various organizational tools for change. These include intellectual tools and actual toolkits. Foundational to this is a concept that we've explored before, which is what is the nature of community? And depending on how you define community, community can be a setting, a target, a resource, or an agent. Community is seen as something you act on or something you act within. One of the key points in McElroy's article is that depending on the assumptions that you bring to how you think about community, you think about your ability to make change within that community as either acting on the individual or acting through organizations. And if you think of a community as simply a setting for a group of individuals, a plate of marbles, that is really different from thinking about how organizations work in establishing community as the target of action, or as a set of resources, or most importantly, as agents of change within their own community. And one of the points he makes is that we really don't have well-established theories of change, and that one of the most functional frameworks to work with is a framework for thinking about organizations within a social ecology. And yes, individuals are important. What they know, what they do, what they believe. And their relationships are important, particularly family and friends and their social network. But critical to having the capacity for social change, for being able to create social capital, are organizations. Organizations including schools and churches and other kinds of nonprofits, as well as the general community local culture and the natural and built environment in which those organizations thrive. And then there's this larger set of issues about particular policies and the legal structures and cultural attitudes about how you think about issues such as public health or risk or disaster. Developing the systemic sensibility, the ability to take a systems perspective when you're developing a theory of community change, is essential. To be able to look and distinguish cultural, legal, economic, political, individual, interpersonal, and environmental factors, and understand how the organization is influenced by all of these and influences all of these. And one of the key takeaways I want you to have from McElroy's article is this quotation: "These problems do not just result from personal choices. Rather, they say something about the social structure and who we are as individuals and as a society." And the next article you read picks up on this idea and amplifies it. And so the article you're reading on capacity building really kind of takes this idea of systemic problems require systemic solutions and operationalizes it, really brings it back home. Now, this article is set in Wichita, Kansas. And so I want you to think about this previous slide that you saw on the social ecology framework, and think about your experience of living through the COVID pandemic and the variety of different reactions people had at the individual, interpersonal, political, legal, economic, and organizational levels. And I want you to think about this image that you're seeing here of a woman sitting in a bar which had just opened in August 2020, and she's masked but waiting for the party to start, and the cultural and social and legal and political attitudes that surround that individual choice. And the authors of this article ask you to think about what you need to do within an organization to build the capacity to address issues in public health, safety, and all the other domains a nonprofit works on. I want you to think about the kinds of tools that are often used in for-profit organizations and in businesses that allow them to be effective. These nonprofit organizations struggle to use those same tools. These include strategic planning, needs assessment, and program evaluation. And capacity building in your organization allows you to be productive and effective within the constraints of your resources. But alas, nonprofit organizations don't have that many resources. The authors of your article ask you to think, how do you manage to build organizational capacity when you're working on the cheap? So here's the dilemma. Nonprofit organizations, community-based organizations, are often quite small, or they lack the expertise in business strategy and product service testing that allows for-profit businesses to thrive. And of course, they don't know what they don't know. When they think about their capacity as an organization, they don't know what's missing. And each organization has very specific assets and challenges that are distinct from every other organization. And so working towards a solution, you think about, how do you capture that expertise? You do so by building partnerships with universities and other larger nonprofits to build that expert capacity. If you don't know what you don't know, use the readily accessible tools to visualize, such as GIS or prioritization matrices. And if each organization is unique, then build an understanding of how these organizations work by constructing a knowledge base of diverse case studies. So Weta Hall and her colleagues look at two case studies, one of a Wichita Head Start and another called Project Access, which tries to identify and serve people in Wichita who are underinsured or uninsured. And in this first example of trying to understand your strategic priorities vis-a-vis all the different Head Start programs that exist, the first step is trying to visualize, where do we need to act? Where is help needed? And so they use the tool of GIS to look at the number of children enrolled in Head Start programs by zip code and really think about, where are these services being used and where should we target our limited resources? So just looking at this map, where would you imagine you start to target the resources? And I would say you target them where they're needed the most, where they're used the most. And that's a relatively simple conclusion to come to based on your visualization tools that allow you to prioritize where you put your efforts. Project Access is a little more complicated because you have a wide variety of partners of medical services who are volunteering their time to help the underinsured and the uninsured get access. You know the basic situation with healthcare in the United States. We have a deeply fragmented system without an overarching public health service available to everyone. So getting public services to the people that need them is a real challenge. Of course, you can use GIS and other kinds of mapping tools to think about this geographically, but this team did something quite interesting. In asking, where are our needs? What services are being used? What services are expensive? And which services need to be the ones that we amplify? They did a different kind of mapping. They used the same kind of idea of mapping, but this time it was mapping the body. And they mapped donated physician services by body system to help them understand, what is the most expensive public health service that's being utilized. So discovering which systems of the body are associated with highest charges and the highest numbers of patients is really useful if you visualize it. And I really want you to think about the power of visualization as a tool for building organizational capacity. Visualization requires pulling together data. Sometimes it's quantitative data, such as from the census material. Sometimes it's qualitative data from interviews, pulling that together to understand what kinds of needs present themselves to the organizations. And visualizing that data helps them identify what they don't know and how they can make that visible and accessible to the decision makers within the organization. It can help them visualize the entire organizational system. It can help them visualize all those invisible constraints, such as wanting to be 20-something partying in spite of the pandemic. It can help you pinpoint the kinds of needs and problems that face a targeted population. Who needs cardiovascular interventions? Who needs basic maternity care? What are the kinds of issues that face the people who are uninsured? That kind of visualization helps you answer those questions and then say, this is where we need to pay attention within our organization. This is where we need to put the resources. And I want you to think about Japantown Prepared and how some of the things that you're considering in your groups leverage these visualization tools.